Hi, I'm Dr Sonya Jessup and I'm talking to you today about non-surgical ways to tighten the vagina. Traditionally, vaginal tightening has been done with surgical procedures such as an anterior and posterior vaginal repair, and in some women this is still the preferred option if they have significant bulging in the vagina after having a baby. For some women, however, there is just a generalized laxity and sometimes a little bit of stress incontinence. And by using a radiofrequency vaginal device, the collagen layers of the vagina can be stimulated to tighten and cause a generalized overall tightening of the vagina without the use of surgery or without the use of vaginal mesh. When women have a degree of incontinence also associated with vaginal laxity, the use of this radiofrequency deep heat in the anterior wall of the vagina and below the urethra can help support the bladder neck and often vastly improve mild incontinence problems. The procedure is a one-off treatment and generally is non-painful. It can be done in the rooms. It takes 45 minutes to do such a procedure. After the procedure, the collagen of the body needs to strengthen and develop, so the full effects aren't evident for about 3 months. But after this, women and their partners often, or usually I should say, find that there is a dramatic increase in sexual feeling for both partners. If you're considering having vaginal tightening, it's well worth exploring these non-surgical methods, but an examination is essential to find out whether this is going to be suitable for you and for whether this is the right procedure for you to have. Generally, the effects last for 18 months to 2 years or over, and many women find that they don't need a further treatment. The device I use is called a Viveve radio frequency device, and it uses a cooling tip to make sure that there's no damage to the vaginal mucosa whilst heating the deeper tissues where the collagen lies. The device can also be used slightly externally to tighten up the labia and the perineal tissues. There is a very big difference between a radiofrequency vaginal treatment and a laser treatment. I perform laser treatments for many women, but these are women who have gone through menopause and who have vaginal atrophy, or for women with lichen sclerosis. When a woman has not gone through menopause, the vaginal tissues are thick and there is very little benefit to thickening up and treating the mucosal layers. When to tighten, you need to have a deeper treatment. It's much like when treating the face. If you had freckles on the surface of the face or very fine superficial lines, you may elect to have a laser treatment of the face. If, however, you have problems with facial laxity, the same principles apply and women choose to have a radiofrequency treatment that tightens the whole skin and collagen beneath. So if you think that a vaginal tightening using a non-surgical method may be right for you, make an appointment and we can see if that would be a treatment that is likely to give you a good success.